Now, what is going to be different about celiac disease and chronic pancreatitis is that celiac disease and chronic pancreatitis, the two unique things about celiac disease and chronic pancreatitis is that celiac disease and chronic pancreatitis are both going to be the only ones presenting with steatorrhea, fat malabsorption. Steat, a $5 word for fat. Rhea means flow of fat from your ass there. Steatorrhea, fat-o-rhea, diarrhea with fat. Rhinorrhea, diarrhea of your nose. Steatorrhea, diarrhea of fat. And that is why the stools here are going to be floating, flying, oily, greasy. It's very significant weight loss. And of all the forms of diarrhea, the one that is going to be most likely to have weight loss is going to be the ones with a fat malabsorption. The ones that have the most weight loss are going to be the ones with a fat malabsorption because fat has the highest caloric content. Floating, flying, oily, greasy, frothy, feculent. Now, you may be looking for me to saying foul smelling. Now, it is foul smelling because it's like fermented fat in your rectum. Like a wine tasting. What is this special thing, this bouquet of this fermented fat? But the foul smelling thing I never quite understood because, first of all, you have to ask people, hey, listen, how does your stool smell? Does anybody ever say, oh, mine smells like flowers? Everybody smells foul. So maybe this is supposed to be especially bad. But the point of it is, all stool smells bad. None of it smells like roses. But this is especially bad because the oily, greasy fat is fermenting in your butt. All right. I got the poetic moment. Get on with it. Well, that's both of them. That is both of them. And as a matter of fact, that not only is both of them, that could be tropical sprue as well. There's celiac sprue and there's tropical sprue as well. Now, personally, if you had to have one, would you rather have tropical sprue or celiac sprue, gluten-sensitive enteropathy? Most people would rather have the tropical sprue because tropical sprue is diagnosed by a biopsy showing microorganisms and tropical sprue can be treated with Bactrim or doxycycline for 6 months, and you are treated. And it's cured. Nothing can cure your gluten-sensitive enteropathy. You have to avoid wheat products for the rest of your life. No more rolls. No more bagels. No more bread? Gee whiz. Gluten-free cake? That's sort of a drag. Oh my goodness. It's a very bready society. Okay? What do you do when you can't have bread for the rest of your life? Tropical sprue, by comparison, is to see the same thing as all these, except person's been visiting a night in the tropics. And they got infected with a bug that blocked the lacteals, and they get a biopsy, and they get treated with antibiotics for a couple of months, and it goes away. Well, what's the difference on these in presentation? Well, probably chronic pancreatitis will give you a history of pancreatitis. That's one thing about chronic pancreatitis, gives you a history of pancreatitis. But the other thing is they both present with a fat malabsorption, all of them do, so you can't truly distinguish them by just the history of fat malabsorption. You can't truly distinguish between these just by the history. So therefore, the only way to truly distinguish between these, in the past, we did D-xylose testing to distinguish whether the bowel wall was normal or the bowel wall was abnormal. D-xylose is an oral labeled substance which should go in you orally and come right out in your urine. So oral labeled D-xylose should come right out in your urine if your bowel wall is normal. However, antibodies against gliadin, anti-gliadin antibodies, which is a $5 word for wheat, or anti-endomysial antibodies, which is a $5 word for your villus structure, and anti-transglutaminase. In other words, we have largely replaced the need for D-xylose testing with much more specific diagnostic testing. Anti-gliadin, I'm allergic to wheat. Anti-endomysium, I'm allergic to wheat and my villus lining. I'm allergic to my bowel wall. D-xylose testing, oral label D-xylose and checking the urine, simply told you my bowel wall is normal, it goes into the urine. My bowel wall is abnormal, it doesn't go into the urine. But anti-gliadin and anti-endomysial antibodies have far greater specificity. It's like haptens for red cell disease. A hapten was a half an antigen that when you took it, like penicillins or quinidine, or alpha-methyl-dopa, that when you took the quinidine or the penicillin or the alpha-methyl-dopa, part of that protein stuck to the surface of the red cell, and it made an antibody that could attack both that antigen on the red cell as well as the red cell itself. And therefore, you would end up having hemolysis on the basis of an antibody response against your red cells, drug-induced hemolysis. But only when you had this foreign antigen, only with this antigen, no hemolysis. The same concept for gluten-sensitive enteropathy. No antigen, no bowel inflammation. No